Hello, everyone. Thank you for joining me today. And thank you to the SCDAA for the opportunity to present on this abstract. My name is Abby Tainter, and I'm the Operations Manager for Sickle. I'm going to be discussing our COVID-19 Community Hub. Sickle is a national sickle cell disease advocacy nonprofit that was founded in 2017, and our mission is to elevate the voices of the sickle cell disease community and their stories of resilience. And in highlighting the grave disparities this community faces, we hope to influence decision makers and propel change. We do this through our programs, our Faces of SCD Storytelling Program and Ambassadors Program. The objectives of our community hub were to reduce the COVID-19 vaccine hesitancy and build trust in the vaccination process within the sickle cell disease community. And through the community hub, we aimed to disseminate trusted information to the sickle cell disease community about the impacts of COVID-19 on people with sickle cell disease and sickle cell trait, to equip community health workers with tools to conduct educational outreach, and to understand barriers to accessing vaccines. Our methods began with a partnership with Demagi Inc. They are a social enterprise that supports frontline health workers with innovative technology. And we also partnered with 5 community-based organizations, which we called the Council. And this included the Sickle Cell Disease Association of Illinois, the supporters of families with sickle cell disease in Oklahoma, Sickle Cell Thalassemia Patient Network in New York, Access Advocacy from California, and the Sickle Cell Disease Association of America, Philly, Delaware Valley chapter, which is in Pennsylvania. And this council served as subject matter experts in the development of the prototype application that was built by Demagi Inc. They were also the users of the application during the prototype and pilot. Our first step was to conduct an environmental scan, and we did this to understand the needs of the community and maximize the use of existing resources, and it was conducted in 3 phases. The first phase was a social media analysis, where we analyzed social media feeds and social media groups, as well as the council's social media accounts, and we summarized common questions, misconceptions, and chatter that we found online. Our second phase was a review of existing resources, where we reviewed existing publications, blogs, articles, and metrics that exist about COVID-19 and COVID-19 vaccines as they relate to this sickle cell disease community. And we also identified trusted sources for medical guidance as well. Our third phase was recurring listening sessions, which were hosted with the Council, Demagi Inc., and Drs. Louis Su and Christiana Hentea. And the goals of these listening sessions were to name and understand common misconceptions about COVID-19 and vaccines, to identify topics to be addressed through the education and awareness outreach, to solicit feedback on barriers to accessing information or vaccines, and to receive feedback on tools and deliverables. Our second step was to build the community hub itself, which utilized a health technology application that's by Demagi Inc. called ComCare. They have actually used this application several other times before and in other countries, and it has been used for data collection of sickle cell disease as well. And we conducted this build in 2 phases. The first was to develop the content that would be used within the app. And we combined information from our environmental scan, our weekly meetings, and our one-to-one conversations with the council organizations. We also generated sickle cell disease specific questions, information, and resources. And we partnered with Apt Associates to tailor drafted content to increase the effectiveness. And Apt Associates is an organization that focuses on strategic communications and enacting social and behavioral changes. We also ensured that all of the materials went through a medical review for medical accuracy. Our second phase was to take the content developed in phase 1 and have Demagi Inc. generate a ComCare application titled the Community Hub. This included a conversation guide, a form for tracking the conversations, and shareable resources. And the functionality of it was reviewed by Sickle and the Council to make sure that it was usable by our community health workers and would be a helpful tool. Our third step of this project was to launch a pilot of the application. So Sickle's first completed 2 training sessions where we learned both the front end and the back end of the community hub. So we were able to use the app, we were able to help others get access to the app, reset passwords, update some questions on the application itself, as well as pull data and information from the forms. Then Sickle's conducted 6 training sessions for the council's community health workers, and various staff members that would be using the app to make sure that they knew how to use the app efficiently and also tips for incorporating it into their workflows. And the organizations then used the Community Hub to guide conversations with members of the sickle cell disease community and then logged the feedback within the forms. The organizations were conducting outreach calls, requesting information about the client's vaccine statuses, feelings about the COVID-19 vaccines, and also offered information to the clients and shared resources through the app. Our first step was to review and report on how the pilot was going. We did do 16 weekly check-in calls during the pilot. And at these calls, we would monitor the app usage, address any barriers to usage, and also review any recommendations for changes or updates. We did try to keep in mind that sometimes questions or comments kept coming up during conversations, and we wanted to make sure that those were included in the application if they weren't. We also completed 7 weekly memos to share the progress and accomplishments and make sure that everyone was kept well up to date with what was going on with the pilot. So the pilot resulted in 222 calls conducted by our community health workers and volunteers. They had 24 individuals that spoke with them, 20 of which were individuals with sickle cell disease, and 4 were family members. The data that they were able to collect from those conversations showed that 9 of them were vaccinated and 15 were unvaccinated. And 5 of those respondents received either Moderna or Pfizer vaccine. 2 received the Johnson & Johnson vaccine, and 2 were actually unsure of which vaccine they received. And the top 3 reasons for not being vaccinated were concerns about side effects, concerns about misinformation, and concerns about pre-existing conditions, which were all things that we were trying to address with using this app. In conclusion, there is a great need for more education to help the sickle cell disease community make informed decisions about the COVID-19 vaccines. And using the Community Hub, we did find that the most common causes of vaccine hesitancy in the sickle cell disease community were concerns about side effects. And then more frequent and reliable information is required to address those concerns and reduce vaccine hesitancy. Thank you so much for coming to this presentation today, and I hope you'll have a great rest of your day.